Hey y'all, so this is exclusively Bobby, MD edition.
Fantasizing, got him fiending for this. He want my number, had to hit him with the hit him with the hit him with the
Hey guys, welcome back to my channel. It's your girl Bobby, and today on this episode of Med Uncut, we're going to be talking about being a mom, being a wife, and being a medical student at the same time. I have the pleasure of interviewing one of my colleagues, and I'm going to allow her to introduce herself.
Hi, my name is Marifel Ocasio, and I'm a first-year SGU student. I am from Dominican Republic, but raised in Massachusetts, and the specialty I'm interested in is family medicine.
So we're going to go right ahead and dive into the first question. Tell me a little bit about your life prior to coming to medical school.
So before medical school, I went right into a career that I didn't even know about. So I always wanted to go to med school, but I didn't have the grades in undergrad. So I'm like, okay, what's plan B for me? Because medical school right now ain't it. So I started to work at the hospital in Massachusetts where I live, and they had a position for data analytics, and I was really in love with what they were doing because it was a way to utilize the data that doctors input into EMR systems to really impact patient care. So I'm like, wow, this could be a different way behind the scenes that I can help impact patient care. So I started the summer between junior year and senior year, and I just fell in love with the work that I was doing, and they loved me. So I'm like, oh, could I stay through senior year? And they allowed me to stay. They were beyond impressed with the work that I was doing. So obviously I was like, okay, it's my time to see if there's a job opening. So I'm like, if you guys have a job opening, can you please consider me for that position? And fortunately, my boss at that time, she's like, oh, I really want to hire you. So she created a data analytics position, and I was actually hired even before graduating. So I had a job set in place before graduating undergrad. So
That's major.
yeah. And I worked there for 10 years, and I really loved what I did, but the wanting to become a doctor didn't go away. And I worked a lot with primary care physicians. So I'm like, oh my God, I really want to be a primary care. We don't have enough representation in the field. So maybe I should do schooling on the side, get ready for the MCAT, and applying to med school while still working. And that's kind of what I did prior to applying to med school.
Okay, that's really good. 10 years. That's
yeah, and I grew in the company. I started as a entry level data analyst, then position open to become senior data analyst. And I don't know if it's a minority thing or a female thing or just me thing, but I never was confident enough to be oh, I could do that job. So my boss, the boss that hired me, she mentored me a lot. She's like, listen, the worst that can happen is you get a no. You should try.
Okay.
So I'm like, okay, you're right. So I applied for the senior data analyst position. It wasn't I got promoted. I had to get interviewed and actually compared to people had more experience than I did, and I got the job. So I grew in the company. I became senior, and then 2 years later, my boss got promoted and her managerial job open. I'm like, well, since she said the worst that can happen is a no, I'm gonna go for her job. So I applied for the management job, and I again went through interviewing. They interviewed people that are better qualified than me, that have more years of managerial experience. I had 0. I just worked there for a lot of years, so I guess that's the advantage that I had. And again, got interviewed by many senior leadership folks at the hospital, and again got the job. And
don't give up.
Yeah,
don't count yourself out of situations.
It was a great time. I grew as a person. I gained leadership skills, and through that I still went to school. As you know, I got married, had a child, so all that I did. Yeah.
What was the defining moment in your educational, personal, or professional journey that brought you to medical school?
So I think working closely with the primary care physicians in my department. So I did population health management, which again is the use of data to create quality projects that will impact patient care. So I worked hand in hand with like physicians and how can we collaborate to like really impact patient care, because the biggest problem that at least I witnessed while working there that they shared with me is like doctors like working together. Like there was a big disconnect between like primary care and like the specialty physicians. So that was a huge problem, especially with our chronic ill patients. Think about a diabetic patient, if like they're going to like a diabetologist and like they're seeing the primary care and they're not talking, well, that's a big problem because then the patient get even sicker. So just through working through like different quality projects, I worked on a chronic kidney disease project, which opened my eyes a lot and like really expanded my skills a lot. And it just showed me like how much disconnect there is, but like how much one physician could drive a change amongst that environment. So I think that's where I'm like, wow, I want to now be in front of the scenes, like really using what like data analysts do to really impact patient care. And that's like, it never died, the wanting to become a doctor. And after a passing of a family member who was really young, and I'm like, you know what, like I felt stuck where I was at. Like I just didn't feel like I was like making a impact. So I'm like, I should just go for my dreams with going into medicine.
How do you balance being a mother, wife, and a medical student?
It's hard. Like I don't even know how I do it, to be quite honest. But the biggest thing is that I feel like I'm a mother first. Everything else follows. Before coming to Grenada, you know, I did the first few terms like online. So that was a huge like, I need to find a balance because my son was always there with me after he came back from school. So I had to find like, okay, how do I make sure I'm still being a mom, but like studying, going to lecture, going to like small groups. And it took discipline, like scheduling. I had to like plan out pretty much my days. I can't say it was perfect. There were many times I'm like, why am I even doing this? Like, but it was just like I wanted to make sure that I was a good mother first, and then everything followed. And with my husband, it was like we were always like, we need to make sure that we always have a date out of the week that we're spending time for ourselves, because obviously like I couldn't give him like every day because I had to study, but he was understanding. And I think that's the biggest thing, that I have a spouse who's very one, committed to me and I'm committed to him, but very supportive. Like if I didn't have that, I probably would not like be here, or we would be having challenges in our marriage. But I think it's because of his support that I've been able to do this. And like, you know, as my son is growing, he's becoming more independent, so that helps too. But it's just being, you know, there for my child as best I can and my husband as best I can, while also studying. And again, it may look like it's easy, but it's not. But you know, I have to stay positive. That's what I tell myself. Just keep going. You got this. It's just a glimpse of my life, and I'll look back and be like, you know, I'm proud that I got through it.
So how often do you see them or talk to them?
So now that I'm in the island and they're staying home, we usually FaceTime every day. I call my son every morning before he goes to school to say good morning, how are you, I love you. I say papi to him. I'm like, I love you, papi. Have a great day at school. And like we just catch up in the mornings, and like making sure my mom is like prepping everything for him, because she's the one helping me, and my husband in the morning. So I check in the mornings, and then after I'm done here at school, I go back home and FaceTime with them once my husband is home, and like catch up again, like, oh, how was school, did you do your homework? And like, you know, like if they're having dinner, sometimes we'll have dinner together. So we kind of do that. And then we have movie nights where we watch a movie together. We've done like cooking nights where like we're FaceTiming, he's cooking, I'm cooking, and like we're just talking and chatting. So that's how I like stay connected to them while I'm here, because I think is the most challenging thing is leaving them. Obviously I knew it was going to be hard, but it's harder than I even thought. So we make sure that we have that time for us, and we're constantly texting and talking. So like we just make sure we're present with one another, and that has really helped me get through it. So
I like that. Have you ever experienced any mom guilt?
every day I think that I've been here, to be quite honest. And every day I question, like, why am I here? One, they're my foundation. Like, I'm here and I know I have friends and I've met like great people, but at the end of the day, they're my rock. They're my everything. Those are the people that I know I could trust, that will walk over fire for me. And not having them present has been really hard. And me leaving my son and missing like seeing him grow up is like where the guilt comes. Because, you know, as a mom, you want to be present for every moment that they're growing, and I'm here pursuing my dreams, and I left my child behind. Like, that's what I always like think about, and I feel horrible. But I always tell myself, like, he'll grow up to be an adult, and I'm only here for a year and a half. And yes, like, I chose to be a mom. Very true. I wanted to have him, and I'm very fortunate to have my son. He's the best thing that ever happened to me. But the thing that made me come, like, pursue medicine and, like, you know, be like, you know, I'm gonna have to sacrifice a year and a half of like seeing him grow, like being like physically there, is that he'll grow up one day, he's gonna have his own family one day, he's gonna leave me, and then I'll probably be, I mean, it's never too late to do medicine, but you know, in my mind I'm like, I'll probably be too old or not even want to do it at that time. So here I have given all my dreams that I wanted to pursue to raise my son, which is great because obviously as a mom, that's your role, that's your duty. But at the same time, I as an individual have dreams and things that I aspire to do. And just because I'm a mom, I don't feel like I have to give it up. So like, for me, that was like the biggest thing. Like, yes, every day I walk around with mom guilt, but I have ways, like positive affirmations to myself that I'm doing the right thing. He's going to be proud of me. This is just a year that, yes, he'll remember, but he'll be like, you know, I spoke to my mom every day. It wasn't like she didn't speak to me. So, yeah, it's challenging, but to me, it's like, at least once he's an adult, he's going to be like, my mom did all these things, so I could do it too. Like, if he has a dream or goal, he knows that he could go for it.
At any point in your journey, did you feel like medical school started to affect your family dynamic?
Last term, I think it affected us a little bit just because it was really challenging. It was really stressful. There was also like different family things going on that I think was impacting us. So I think it was harder that time to find that balance that we had found when I first had started, of like making sure that we're going out, making sure we have our like me and him time. My son, like making sure he understood like, okay, mommy is studying, but you know, as they're growing, at times they need more of your help, more of your attention. Sometimes they don't understand their children, so it's like many times he'll just bust into the room and be like, oh mommy, I want this, I want that. I'm like, I'm studying. So like that was a challenge, but like again, I think once we reached a point that it was like, wow, okay, we need to like reground ourselves, we need to find the balance again, I think it came back. So it's like I always say it's like a roller coaster ride. You have your highs and your lows.
True.
Yeah.
At times when you feel discouraged or start to wonder whether you made the right decision to attend medical school, what puts a smile on your face?
So like right now, since like I said, it's hard to be here by myself. I have 2 pictures on my like mirror of my son, his passport picture actually, because they give you 2. And then we had gone to Chuck E. Cheese before like I made the final move here, and I have those 2 pictures in my mirror. I see them every day. It puts a smile on my face. And hearing his voice, I think like hearing his voice like just makes me feel good. And I'm like, I miss my baby, but like hearing him is like you know, makes me feel really good inside. And like talking to my husband in the mornings as well. Like if I don't say good morning or like he doesn't respond, I'm like, okay, this day is gonna turn out really wrong. Yeah, they are the ones that definitely put a smile on my face every day.
Last question. What is one piece of advice you have for pre-med students or anyone thinking on becoming a doctor?
Definitely follow your dreams. Don't give up. Like one of the things I challenged before, and I'm glad that it took me the time it took me to apply to med school, because I was able to build myself as a person. I don't think that if I had applied right after undergrad, I would have succeeded, just because I don't think I had the grit to deal with a lot of the challenges that we are hit with. And even then, I still have my lows as far as like mental health and things like that. But I find ways to bring myself out of it. But I think like if I had done it after undergrad, it would have been even harder to stick to it. So I think the biggest thing is follow your dreams, never give up. If you need time to find yourself before applying to med school, that's fine, because actually that's going to help you be a stronger person, to be able to deal with the things that are come your way while you're in med school. So I think that there's not a timeline at all. There's not a correct way or a wrong way to do things, you know, like I know that in my culture they'll be like, oh, you should have just done it right after undergrad, like why did you get married and have children and then do it? I'm like, well, that's how it happened, like
your path is your path.
Exactly. So I think just follow your dreams, don't listen to what people have to say, and do you, like just do you, and you'll be proud of yourself that you followed your heart and did not listen to people that are just there to bring you down.
Yeah. Okay, guys, so that was the last question. First, I'd like to thank Maribel for allowing me to interview her. Thank you.
Thank you for having me.
I hope you guys really enjoyed this segment, and if you have any questions or comments, just drop them below and I'll try my best to answer them. Stay tuned, guys, because once again, there's more coming. For now, bye.
With the hit 'em with the